Hi, my name is Andrea. I'm the practice coordinator here at Integra Health and Wellness, and today we are going to go over the lab instructions for the nutritional analysis lab. Before we go over those instructions though, there are a few things to know about this lab. First, it is a 12-hour fast, so if your lab appointment with us is at 8 in the morning, that means nothing after 8 p.m. the night before. There are 3 components to this lab: blood, urine, and saliva, and you also have to be off of supplementation 5 days prior to doing this lab. So when you open up this box for the first time, there's going to be an insulated box inside. There's going to be a full sheet of labels, so each sample that you collect is going to have a label attached to it with your date of birth and your date of collection. There's going to be instructions in one of the bags. This bag also has 2 tubes for your urine collection. There's going to be other tubes inside the box. This is all for our phlebotomist, so you don't have to worry about anything in here. But you are going to want to take out the ice pack and put this directly into the freezer. So as soon as you receive this lab, you're going to want to freeze the ice pack. And then for the genomics portion, which is the saliva portion of the lab, you are going to take out the swab. So these are the 2 components that you are going to be responsible for, the urine and the saliva, and then you're going to bring this box back to us with the rest of the tubes in, and you are going to have our phlebotomist is going to take care of the rest. So on the morning of your appointment, you're going to collect your first morning urine. We can provide you with a cup, so it'll look something like this, and then you can either gently or very carefully pour it into both of these tubes. There's going to be 2 tubes. So there's going to be a clear tube, green top, and a blue top, brown tube, and you can use the pipette to collect your urine, or you can carefully pour it into these tubes. You're going to put a sticker on each one of the tubes with your date of birth and date of collection, and you're going to put these into the freezer immediately. And you're going to freeze your urine up until you leave for your appointment. So if you collect your first morning urine at 6 a.m. then you're going to put it in the freezer until 7:30 until you come to your appointment. And then from there, you're also going to collect your saliva. So this is the genomics portion of the nutritional analysis, and what you're going to do is you are going to collect this is first thing in the morning as well, before you brushing your teeth and before having anything to drink, including water. So you're going to want to open the sleeve about 1/4 of the way, and you're going to swab for 30 seconds on one side, let it air dry. You're going to swab for 30 seconds on the other side, let it air dry. Now, just to warn you, what a lot of patients will do is they'll set it on a surface, and then it'll roll off of that surface and get contaminated on whatever is on their counter or their medicine cabinet or their sink. So our recommendation is placing it cotton side up in a cup, in a clean cup, and then give it about 15-20 minutes to air dry. And then you're going to want to place it back into the sleeve. This is really important. The lab won't accept your cotton swabs if they're not back in this sterile sleeve. So once they're back in the sleeve, you're going to place it into this envelope, and then this envelope gets a sticker with your date of birth and date of collection. Now, what you're going to do when you leave for your appointment is you're going to want to put your ice pack back in the insulated box, put your urine samples back in the box, bring your genomics portion with you, and then report to your lab time. And then from there, either myself or our wellness coordinator, Yoli, will double check to make sure everything is completed and everything's done correctly. And then we will go ahead and take the box from you, and then you would go into your blood collection for this part of the lab. So our phlebotomist takes care of that part, and then you're all set. So that's essentially it for the nutritional analysis. You're more than welcome to reach out to the team if you have any additional questions. Thank you.